Hello, I'm Sui. Today I will be presenting an approach to a patient with limb in groin. I have been working as a medical educator for 14 years, but my background is a surgeon, so it is my pleasure to present creating the concept map of a surgical symptom. Concept map are listing differential diagnosis and way to narrow down. So we start our concept map with developing differential diagnosis. You can develop differential according to the surgical filter, according to the anatomy of nearby structure. Start by anatomy. Here is the list of length that can come from skin and soft tissue. It might be a vascular or lymphatic origin, femoral or inguinal hernia, and a renal or urogenital cause. It also could be male-descended testes and transplant kidney. My colleague Dr. Sudin contributed to this concept map for our program. She also gave another example of listing differential diagnosis by using surgical filter. Vitamin C, D, E, F, vascular cause, inflammatory, infected, traumatic, autoimmune, metabolic, iatrogenic, neoplastic, neurological, nutritional, congenital, degenerative, endocrine, pensioner. How can we narrow them down? What defining criteria will you use? Obviously, the history will support your differential diagnosis associated with weightlifting, weight loss, any fever, any symptom of an inflammation, red hot panda, family history, onset, duration, reducible only in the inguinal region, or it go beyond, just like inguinal scrotal swelling. But in this concept map, we focus on physical finding rather than the history. The first defining criteria is whether it has cough impulse or not, reducible or not. If yes, it must be hernia. Then look relation to inguinal hernia, inguinal ligament to see whether femoral or inguinal. If it is an inguinal hernia, you can distinguish direct or indirect inguinal hernia by covering the deep ring. Then ask the patient to cough or stand. The deep ring is the midpoint of the inguinal ligament. It is different to mid-inguinal point where femoral artery is. If there is no cough impulse, the second crossroad is the characteristic of the swelling. Compressible, versatile, transilluminate, consistency, hard, soft, able to get above the length or flatulent. Compressible, saphenous varies. If it is versatile, it could be aneurysm, transillumination positive, think hydrosis of the cord. Consider consistency and distinguish lipoma or male-descended testes. If flatulent, tenderness can also isolate the diagnosis. Thank you, Dr. Sudin, for this presentation, concept map, and this nice picture. One important thing I should mention here is that not all the patients come with a typical presentation for the disease. There are some cases present less prevalent condition or less typical presentation or unusual presentation with increased difficulty. This makes clinical reasoning difficult, subjecting it to the diagnosis error and compromise patient safety. For example, hernia will not have cough impulse anymore when it becomes strangulated. So you can follow this concept map for typical presentation of the disease, but please train yourself to thinking about your thinking. Double check your initial diagnosis. In medical field, everything could be possible and we are dealing with uncertainty. So take a few moments and ask yourself a few questions to screen for risk or error. What is the evidence of your working diagnosis? What else could this be? What finding does not fit with your diagnosis? Could there be a multiple process going on at once? Any further investigation do I need? Indeed, the carefully applied double check have been proposed as the marker of true clinical expertise, and this process can help ensure that corners are not cut. Thank you for listening, and I hope you enjoy it.